this is what is happening, is what they say.
Right.
So any doctor saying that you don't eat food should not be the answer to it.
Right.
Basically, you have to start therapy with 3 different angles. Now, the 3 different angles, one is medication, second one is diet, third one is exercise. These are the 3 different strong angles. When we talk about medications, if she's having insulin resistance, we need to give medication, insulin sensitizers. Any thyroid prolactin abnormalities, we need to correct them. Any other hormonal imbalances, we need to correct them. And along with insulin sensitizers, we need to explain them that these might have some kind of small side effects, and you really need to take them slowly, half the dose first, and then slowly increase the dose. And we should explain them what will be the side effects that they can anticipate. Sometimes they can have bloating, little bit of loose motions, little bit of nausea and all that, which eventually come down. And it should always be in a strategy. If somebody is having irregular periods, you should not straight away give them contraceptive pills so that they regularize their periods. That is not the solution for PCO. You should treat PCO where insulin resistance is something that you need to treat. Increased androgens is something that you need to treat, and not just the manifestation of a symptom like irregular periods. So there is definitely sense in what we actually should give them and treat. And the second most important angle, as I told you, is the food. Whenever you have somebody with PCO in front of you, you should try and tell them that simple carbs are your enemy. So you should never have anything that just releases calories, like, white rice, maida, sweets, chocolates, sugars, juices, cool drinks, loads and loads of coconut water. They're even having liters these days. And anything that, abruptly disturbs your fast calorie release. And something that releases fast calories should be always a no-no. And you should always encourage them to have complex carbohydrates, like, millets. You can always promote jawar, bajra, and all millets. And we should always tell them to have whole vegetables. A lot of vegetables, legumes, lentils, pulses, all these will give that satiety angle. And any amount of simple carbs that they are taking, again, it will take away the treatment aspect from us. And because of insulin resistance, they will not be able to fare well.
Right.
So all legumes, lentils, pulses, vegetables. You can have non-vegetarian also, or non-vegetarian. Once or twice in a week should be fine. Egg is good enough. So fat is not their, enemy.
Right.
Carbs are their enemy.
Right.
So minimum to moderate amount of fat is definitely necessary for their well-being. And cold pressed oils is something that is important. You can always have, butter, ghee in moderation, not a problem at all. And diet is something that needs a lot of discipline. And with diet comes fitness. And with fitness, you can conquer PCO. So this is another 30%. The last 30% that I would talk about is adequate exercise. If you're not doing exercise, if you're not doing, physical activity, it can be as simple as doing your daily chores. You can do your daily household work. That is also going to be very, very helpful in controlling your PCO, because it is consistent, it is daily, it is physical activity, and it burns calories. If somebody who can't do daily chores, they can do their regular activities like, walking, yoga, running, swimming, and, meditation. And there are fancy things that always run, like Pilates, and all these things are also there. Whoever is accessible to whatever kind of physical activity, they can go ahead and do. And something that is very important is consistency. If they should be consistent in doing that, not for a short period of time, but for ever. So anything that you choose, you should think about things like PCO is not reversible. You can always 100% control it through daily discipline and curriculum, that you should take your medications on time, and you can be off medications after some time. When your weight gets controlled, your lifestyle factors are all controlled, then you can be off medication, but you cannot be off lifestyle factors. So discipline is something that is important. And two shorter ancillary factors that really work well
the nuggets.
Yeah, the 10%
Yeah.
is adequate sleep. You should maintain your sleep, and that is the core or essence of repair of your body.
Right.
Especially when you talk about hormones that are releasing from your brain. If you do not sleep and if you do not shut down, it'll be all chaos.
Right.
So somebody who's watching and binge watching whole night, it's about you that I'm talking about. Your PCO will never get controlled if you're not disciplined enough to regulate your sleep and your repair mechanism is not in place. And the another very important thing that is very, very important to regulate all these things is you should maintain your stress levels damn low. So if you're stressed out and if you're anxious and if you're buried in depression, how will you control the 95% that I'm talking about?
Right.
So these days, women are giving a lot of importance to stressful situations. And the more they try to be a perfectionist, the more they want to do, you know, enormous amount of work, multitask and all that, the stress is increasing. You can as well manage your stress, de-stress yourself so that your hormones are in place, de-stress yourself, your food is in place, de-stress yourself, your sleep is in place, de-stress yourself, and you auto-regulate your exercise mechanism. So this is a gist about PCO management.
Great. So ma'am, just to summarize, I think on the lighter side, don't watch those soap operas of Saas Bahu, because then the hormones will play Saas on you, right? Or act like a Saas and Saas Bahu inside you. So I think if we were to, ma'am, summarize the treatment approaches, then if you allow me, there are essentially 4 pillars, right? So first is, of course, the right medication. So you should go to the right specialist and take the right guidance and the right medicine, right? The second is the diet, because we understood that the underlying principle is insulin resistance, which is around the glucose metabolism. So we should avoid, simple carbs. We should, of course, have other aspects in terms of complex carbs and the right amount of fat in our food. And exercise is very important. And I think the fourth pillar, which I want to introduce, which I think you mentioned, is your mental health. So don't take stress, right? Otherwise, it becomes a kind of a vicious cycle, right? You take more stress, because of which probably you're not able to, comply or be regular to what you emphasized, either on your medicine or your diet or your exercise, right? So the fourth pillar actually should be the strongest pillar, so that it, supports the other 3 pillars to be, implemented.
Yes.
Okay, great. Thank you, ma'am. Thanks a lot. I think what we want to move towards as well is, ma'am, that we talked about the treatment, we talked about the 4 pillars. What other health problems can PCOD lead to, including specifically related to pregnancy?
Now, PCO is very, very notorious because it not only leads to obesity and obesity problems like diabetes, hypertension, cholesterol and lipid metabolism abnormalities, and anything and everything that is related to obesity, like even cancers. It can increase the risk of ovarian cancer, it can increase the risk of breast cancer, it can increase the risk of several cancers out there, including colon. So obesity is a pandemic nowadays. And for me, the affluent population or working population or the working women population and children who are sitting and doing their studies for hours together without any sports and all these things, they are a highly vulnerable population for obesity. And with obesity come all these problems. Right. I have seen so many, more than 50% of women out there who are suffering with infertility, it's PCOD. Right. And 50% of early diabetic women are PCOD again. So PCO is not a small thing. It is invaded into multiple systems, both short-term, mid-term, and long-term problems, as we are talking about. Short-term is irregular periods, mid-term is fertility issues, diabetes, and long-term is cancers. So PCOD is not to be taken lightly, and it is a problem that you can absolutely put it on the ground under your feet if you have to control it. It needs discipline, and that discipline is needed for a successful life, not only as health in your body, in your career also. So when you talk about discipline, automatically, if you have discipline in your workspace, if you have discipline at your house, you should also have discipline with your body.
Great. No, thanks, ma'am. So I think not looking at the short term, but then also the long term. You want to, if you want to have a good, healthy quality of life, then please take the bull by the horns and try to get this treated and get this under
Yes,
control.
correct.
Right. And just one thing that you mentioned about, ma'am, the simple carbs, right? We
Yes.
should avoid. So, PCOD is that please cut out sugar. Please
Yes.
cut out the
Sugar.
desserts,
Yes.
right? PCOD or PCOS. You can just simply remember that. See, whenever you recall that PCOS is please cut out sugar or please cut out the desserts, right? And that should help you.
Yes.
Right. Thank you, ma'am. So, ma'am, I'll share some statistics, right? And you said obesity, the sedentary lifestyle, especially in the corporate working women, is one of the reasons. So we have some data that almost 50% of the working women in the age group of 23 to 35 actually are either overweight or obese.
Yes.
Right. So their BMI is actually more than 25. So I think what we need to specifically then focus on is that you mentioned 80 to 90% of the patients walking into your clinic are complaining of PCOD. We know one of the reasons is obesity, the corporate lifestyle that we have, or the eating habits. Now, specifically now focusing on the challenges in working women, ma'am. How can women try to, especially when they're working, try to, cope up with PCOD?
Now, this is a very good question, because women out there who are working, first and foremost is they should get back to work. Stop working from home, because the more you work from home, the more physical, outlook is not there. You're restricted to a certain place and you are overloaded, and you underfunction your body. The moment you're working at your workplace, you either commute, you walk around, you go to the washrooms, or you walk around till the office gate, come back, so that there is some kind of an activity. And even to drink water, you can go to certain place or go to the washroom for certain distance and then come back. And there are studies proven that working from home has increased the rate of obesity, especially with PCO. It has also increased the rate of so many complications like fertility also. And I am a person who's anti work from home culture, because even with pregnancy, women are trying to work from home and cutting down on their calorie expenditure. And there is so much of obesity that is coming up. The next generation, if exposed to high sugars, will turn out to be positive for PCO. So PCO is also gifted in that way from the mother's womb to the outside. So there is something that is very interesting, and people should know that whatever happens when the mother is pregnant, that is epigenetics. If you are obese, you can give the obesity gene. If you are having diabetes, you can give the diabetes gene to the baby. In a similar way, a PCOD mother can transmit the baby to the baby to become PCO if she is not under control of her PCOD, in terms of her diet and, glycemic control and everything. So in this work front, you should always opt to work from office. And even at office, you're asked to complete a task, whether you sit and complete a task or stand and complete a task. Nobody has given you any single written statement. So you can have a desk which is a little height. You can stand at times and work with your laptop while standing, and make sure if there is a call that you need to take, walk while you're taking your call.
Right.
And cut down on drinks like tea, coffee with milk. These are something that have increased tremendously the amount of sugar that we take, and milk is also another calorie added to it.
Right.
So if somebody has to have coffee and tea, have black coffee and black tea. But even if you cut down on sugar and milk from the tea or coffee that you have, you will not pile up 5 kgs a year. So it is not a small number. 5 kgs a year is something that you're piling up with only tea and coffee with milk and sugar, even if you take 2 portions in a day. So it is very much understood that what is the next thing that you need to take. And Women out there think that juices are very good, liquids are very good. Liquids other than water are not good. And if you really want to have any quench thirsting liquids, buttermilk is okay, ragi malt is okay. Again, detox water without sugar is okay. But nothing with sugar and high calorie is good for your body. So anything that you need to have is by chewing with your teeth, and chewing food and eating food will give you that satiety. And if you have high portion of food, then definitely you should chew and eat protein first so that you're full, and then you should take in carbs.
Right.
So for all dessert lovers there, please do not have your dessert before your food. You can have a spoonful after your food.
Okay.
Just in case if you feel like eating it after even having satiety.
Great. No, thanks, ma'am. I think you have covered a lot of aspects which I wanted to touch upon, especially for working women, is that they have anyways a work stress, work-related stress, but do not let go of your PCOS management,
Yes.
right? Otherwise, it becomes a vicious cycle. The stress would lead you to not comply to your management protocol that you have. And then if you're not managing, it would further lead to stress because you're not 100% efficient in the work that you have to do. And I think the small tips that you have given, especially around that the snacks that you have or the tea
Yes.
that you have at the workplace, they may seem very inviting. They may seem very convenient,
Yes.
right?
And the biscuits.
And the biscuits, yes.
They're junk.
Yeah, the butter cookies, right? So, but I think what you should try to do is that if you are able to control, and it may seem convenient, it may seem your habit, but if you accept and you're able to overcome that, no, you have to avoid these, then it will start bringing in an impact. Like ma'am said, 5 kgs a year adds up to a lot, right? So I think in terms of managing your work along with the management of PCO, plus the diet that you have, plus some small tips on exercise, like taking the call while walking, every now and then doing some exercise at your chair. And I really like, I'll just share this with all the viewers, that when you enter the doctor's cabin, ma'am's cabin, it's very clearly written, you are not allowed to work from home, right? So I think you are a
Yes.
strong propagator that
Yes.
if you move out of your home, you become more active.
Yes.
Right. And that is what is required for peace.
And you also have to tell what is the second line that is written.
Yes. The travel that you may want while you're pregnant, right? I think that's the second line, and you just
Yes.
had a reel on that. Yeah.
Yes. Travel during pregnancy, or for travel for matter, anybody these days is associated with so much of food.
Yeah.
Travel is all about food, and you gorge food. And even if you go to your mother's place or any relatives or any function, there is priority for food, and people are just mad at having food. The moment they go for any holiday or any travel, even travel where they've gone for a death also,
Right.
they eat, prioritize food, and they serve food like a lot. And they all come back with a lot of weight gain. So unnecessary travel is absolutely no. And it's for, especially with PCO, so definitely no.
Great. Thanks, ma'am. And I think I'll just conclude also one statement which you very insightful. You mentioned about the epigenomics, right?
Yes. Yes.
So I fundamentally believe that the best gift a mother can give to an unborn child is her health.
Yes.
Right. So both physical and
mental.
mental. Yes, and
Yes.
mental. Yes. Right. So I think thanks for that. So I think with that we've covered a lot, ma'am, in terms of understanding the disease, and then in the corporate world what we should try to focus on. I think one question which I have encountered in many women is that other people don't understand what that patient or that person who is suffering from PCOS is undergoing.
Yes.
So I think if some tips you can also mention, that be open about it in terms of either acceptance or discussing this and getting the right awareness would help. So if you can talk
So
about that.
definitely people around, women suffering with PCO, if they really are concerned and they have that love and affection for the woman that is undergoing and suffering with PCO, their responsibility is to take her for a walk, talk to her, and make sure that they pack something healthy for her, like a fruit, like a snack, like a boiled egg kind of a thing, or any peanuts in the box, or anything that is made of complex carbohydrates, just to encourage healthy eating. And if you do it with dedication and love, they would definitely eat that rather than, their hands going everywhere around.
Right.
And also, the more you have conversations, the more their mental ability to cope up with such situations will improve. And I definitely tell that tender loving care is important for women with PCO. And their insulin resistance also is governed by not only what they eat, how they fare in their day-to-day life, managing stress, managing relationships, managing complex problems like fertility issues. And fertility is so deeply rooted in our society that even with PCO, the whole focus goes on PCO only. But there is a male partner who also has a sperm related issue, which is never checked because she has PCO, she has PCO. PCO doesn't mean that there is fertility issue. If you give medications, if you control the weight, they are the best responders for fertility.
Okay.
And they naturally produce egg and they naturally become pregnant. Once they become fit and healthy, lose weight, their fitness comes back. The first thing that comes back is their ovulation and pregnancy.
Cycle comes back. Yeah.
It is not like that in case of men.
Right.
Men really have to work very hard to change the parameters that have gone wrong, because egg formation is 15 days. We can give medication for egg formation, but spermatogenesis is 60 days. So it will take a lot of time for male factors to improve and cultivate health in their bodies if they have any addictions, say smoking or alcohol or any other substance abuse or use of lot of radiation and high stress works and all these things. They need a lot of time to correct. So rather than, having that blame game, you should always work together.
Right.
Understand situations together and be with that love, care, and attention that is actually needed more than anything other than the doctor for her to heal.
Right. I think thanks a lot, ma'am. So I think you're not alone out there if you have that disease. If you are able to have the right support from your partner, from your family, I think you will be able to overcome and be able to deal with it.
Yes.
Right. So, ma'am, let's move to the last section before we move to the Q&A. So please post your questions in the chat window.
A lot of them already are.
Yeah. So we'll, ma'am,
Yeah.
very quick rapid fire, right? For the myths, right,
Yes.
that we want to bust. So there are a few myths, and I'll just read them out. PCOS is a rare condition.
No, it is very common.
Only overweight women get PCOS.
Never. It's always there. Thin PCO is definitely there.
Okay. You can't get pregnant if you have PCOS.
You can get pregnant with good discipline.
Okay. Every woman with PCOS has ovarian cysts.
It is not about ovarian cysts. It's a condition where you have polycystic ovary. Ovarian cyst is different. PCOD is different.
Losing weight will cure PCOS.
It will control PCOD.
Okay. PCOS is only a reproductive disorder.
No, it is not. You can actually have diabetes, hypertension, obesity related problems and cancers also. So it is just a phase that you need reproduction, and that's fertility issues, one amongst the problems that it can cause.
Great. PCOS symptoms are the same for everyone.
It is not the same for everyone. There are women who actually have regular PCOS, regular cycles in PCOS, but still they have acne, still they have excessive hair, still they have no egg formation, still they have bad egg quality.
Great. Birth control pills cure PCOS.
Birth control pills do not cure PCOS. They are one method to get regular periods, first thing. One method where you can control your acne, second thing. One method to have consistent regular periods without having heavy bleeding, heavy cramps, irregularities, and blood loss.
Great. Last one, and before we jump on to the Q&A, PCOS only affects women of childbearing age.
It doesn't. PCOS is seen even at the age of 12 years. It is also seen at the age of 40 years. It is not about childbearing age. It's a phase of entire reproductive journey that the woman passes. PCOS is everywhere. And let's take some quick questions.
Sure, ma'am.
And
You will read them out, ma'am?
yeah, you can also read. There is Srivarsha who's saying that she's in her first trimester suffering from fever. Can I take Tylenol? Of course, yes, you can take Tylenol. But the reason behind fever has to be checked. Shweta is asking her periods are regular, but the flow is only for 2 days. And she's got 4 follicles and a history of 2 failed IVFs. Your period cycle is normal. Your low AMH does not rule out that you don't have eggs. You still have eggs. Work out on the male factor and again improve the quality of life. Your fitness will give you good equality and a natural pregnancy. And Manisha is asking, let us know about the placental position. Usually the placental position is front, back, up. Any placenta that is low is a little abnormal and you need to watch over that. And placental position matters for delivery if the placenta is completely down at the time of delivery. And Vijaya has asked what is PCOM. That is what we've talked about all this time. And Radhika is asking whether VBAC is possible at the age of 35. Age is not a number. Age is just a number for, VBAC. VBAC can happen at any age. And Gopal Krishna is asking, talk about hydrosalpinx and fibroid treatment. Hydrosalpinx is infection of the tube. Fibroid is a tumor in the uterus. Though it's a benign tumor, should not worry. Hydrosalpinx need to be treated. Fibroids, if they are big, need to be removed. If they are small, it's okay. And the position of fibroid is also very important. Jyoti was asking, is there any medicine for PCOS and PCOD? Definitely there are medicines for PCOS and PCOD. And you should contact your doctor. It is definitely medication as a part and parcel of the treatment. To reverse insulin resistance, that's a very good question, Shaitali. Insulin resistance can be reversed. First, you should start with insulin sensitizers, lose weight, become fitter, control your diet, do regular exercise, make sure your metabolic rate is increased with food and your activities, then definitely insulin resistance can be reversed. And Vidyadish is asking, I have got periods regular, but I'm married 2 years back, not able to conceive. What is the problem? You need to check the husband's sperm also and go for a follicular study and get your hormones checked once. And Swasana is asking, I'm at the age of 36. I have PCOD. Last year, October, I had a polypectomy surgery. I have gone to ovulation induction for 6 months and I've taken very high dosage of hormonal injections. Yes, PCO, if it is not controlled through the mechanisms that I have told you, you might need excessive usage of hormones, excessive usage of any of the fertility treatments, but the quality of egg will not improve, implantations will not improve, pregnancy rates will not improve, and take home baby rates also will not improve. So you should work on yourself and your fitness for getting pregnant and taking the baby home. And Prasanna is asking, let me know about how to improve amniotic fluid at 4 months. Definitely increase water intake, sleep left or right side, stress free, important to relax, and also certain medications improve in amniotic fluid. Somebody has excess fat all over the tummy side and now I'm going for IVF treatment. So please tell me how to reduce it. This is what insulin resistance is. If you have fat all over the tummy, then definitely look for insulin resistance and treat it properly. AMH 13.7, Vijaya care of her in a better way.
Okay. Please get her checked from the specialist, or you can take an online consult with us, and then we'll see that what needs to be done. Thank you. A very interesting question from Priya. Is there any PCOD scale? Or if it is, how to know my PCOD scale is whether it is low, I'm suffering from severe, or I'm suffering from mild?
It is the complaints that you have. If you have a single complaint, probably I can tell you that you can address to it. If you have multiple complaints, then that is severe PCOD.
Right. So let me just see. Okay. How to fix light periods in PCOS? Periods are regular, but flow is less.
It is always hormonal balance. If you have less period flow, then check your thyroid and prolactin. Might be you'll find a solution there.
Great. So I think, ma'am, those were the questions I had. Any more questions coming for you?
We are good.
We're good.
And
Great. So I think a couple of things, ma'am.
Yes.
We would just like to emphasize to all our viewers. First of all, thanks a lot to you, ma'am, for a very enlightening session. And I'm sure what we started was that let there be light. So I'm sure that all of you have been enlightened by the practical and very simple takeaways from this session. So thanks a lot for that, ma'am. And what we would also like to share that we have a PCOD management program on our.
It's a comprehensive program.
It's a comprehensive program because it includes a doctor consultation, an internal medicine doctor consultation, a dietitian consultation, and also an exercise, right? And along with the lab tests. So please check that out. If you are registering and you refer to this particular webinar, we'll be able to extend a discount as well for all of you. So we'll post the link in the chat to for you to be able to access and evaluate that for that program. And before we wrap up, I would like to thank Dr. K. Shilpi Reddy for her insights. Please download her app if you want to have a consultation with her. Please look at the program, PCOD management program online. And I would also like to thank, in association with whom we are conducting this webinar, Arogya World Health. And, we'll play a short video, of theirs. And, of course, we align in our collective aim that, if we are able to ensure, your health today, it ensures a healthy future for all of us.
Definitely. And everybody out there who's, having PCOD as an issue, don't think it is involving only you. As a woman, tomorrow you will have reproductive function, you will have pregnancy as a priority. As age advances, then definitely it is going to hamper that function. So it is always better at a younger stage, at a stage when you can really control it. Look at it as a lifestyle problem. Look at it that is hampering your fitness. So make sure that it is treated as priority, taken care as priority, because nowadays, once you're pregnant with obesity and PCOD, again, you will not be able to do much because discipline is not there. And food is something that pulls our tongue, mind, body, heart, everything into it. And it's difficult to control your cravings. And PCOD is all about the sugar cravings, carb cravings that tremendously affect women day in and day out. So manage your lifestyle because during pregnancy, if you're not controlled, PCO can lead to gestational diabetes, and baby can inherit diabetes this way, PCO this way. It's not only you, complex phenomena, and is the need of the hour to take care of it in a very strong way. The message goes clear. It's team effort, and a single person cannot in PCO. You need a team effort, and team management and comprehensive care is the strategy way forward to take care of you.
Great. Well, thanks, Dr. Shilpi Reddy. So, our motto, Assurance by NanoHealth, is preventing hospitalization. It's to be proactive about our health and also so with Dr. Shilpi Reddy as our partner, especially for women health, we look forward to ensuring health for all the women in the workplace and making, ensuring that a
And
healthy
health
future.
at your
Health.
is very important.
Yes, so teleconsultation, online programs, please log on, and wishing you a continuous good health. Thanks a lot.
Onset of these conditions has been found to be relatively earlier among Indians. The most effective way to contain the incidences of NCDs is prevention through health education and lifestyle change. Arogya World, a recipient of the prestigious UN Award, launched its Healthy Workplace program in 2012, which is scientifically designed, evidence-based, and outcome-driven, and recognizes workplaces that have institutionalized a culture of employee well-being based on our robust criteria. The Healthy Workplace globally acclaimed criteria was co-created with industry leaders and academia and medical professionals and is implemented in 3 levels: bronze, silver, and gold. This includes guidelines such as no tobacco policy, easy access to healthy foods, opportunities for physical activity, and focus on mental well-being. We conduct meticulous assessment of workplaces to evaluate the employee health standards and recognize companies as healthy workplaces at our annual conference and award ceremony. Our highest accreditation in the form of platinum certification is reserved for exemplary workplace data-driven approach, having leaders-led initiatives demonstrating continuous improvement in vital employee health metrics. Arogya World provides extensive support to sustain and advance all wellness initiatives through its flagship programs like lifestyle modification coaching, educational webinars on mental and physical wellness, and My Thali programs to help employees make healthy eating choices. In 2020, Arogya launched an extensively researched mental health criteria as a part of its Healthy Workplace framework to help corporates address employee mental well-being in a structured manner. As of 2023, Arogya World has recognized more than 200 plus companies from multiple sectors, including organizations such as TCS, Mercedes, Honeywell, Hero MotoCorp, Reliance, HPCL, and HSBC, to name a few, impacting the lives of more than 7 million employees. We have a highly committed team of industry leaders and well-being experts passionately working towards our mission. We couldn't have achieved this milestone without the able support of progressive companies, industry associations, and strong partner ecosystem. Our emphasis is on clear benchmarking criteria, rigorous assessment process, great conferences, and team passion to improve the physical and mental health of the working Indians. We are proud to achieve the prestigious Global Digital Health Innovation Award 2023 for developing innovative, accessible, and affordable services to transform healthcare. Arogya World has definitely advanced the dialogue on workplace health in India. We invite you to join the League of Healthy Workplaces.